Good afternoon, everyone, and I appreciate you for joining our call today. I am Amanda Slater, and I am one of the Assistant Deputy Directors for the Department of Health and Human Services. For those of you that are new to this call, just a quick little reminder and housekeeping. We do try to have a division representative for each of the divisions or offices that are available for questions. Some of them will give updates, otherwise they'll be here so you can ask those questions in the chat. This meeting will be recorded for those of you that are not able to attend today. It'll be posted on our website. You'll be able to review that. For those of you that would like closed captioning, at the bottom of your Zoom, you'll see the two CCs that you could click to turn on your closed captioning as well. The other thing is at any time during the call, you can enter your questions to the Q&A section, and we'll do our best to answer those questions today. If for some reason we don't have the answer, we will definitely try to get back to you after with the answer. In addition to the questions during this call, if you have ones before or after these quarterly meetings, you can always submit those questions via email, and we will drop that email in the chat for you. And then we will try to address those questions on these quarterly calls. Of course, as you have questions as you're working with the department, you do not need to wait for the quarterly calls. All the individuals on this meeting, feel free to reach out to them at any time as questions arise or via that email chat. So to go ahead and kick it off today, I'm going to first turn it over to Carrie Brambro to give an update from the Continuous Quality and Improvement Office.
Thanks, Amanda. And yes, I'm Carrie Bambro, and I'm with the Office of Service Review and covering for Shannon today for the Division of Continuous Quality and Improvement. We just have a couple of updates that we wanted to share. We are working on updating all of the review tools for the quality management reviews that all of you will have. They will be available by the end of July. So we're trying to make resources available on their website for all of our contracted providers, and that's sort of one of the steps that we're working through this year. So if you want to refer back to those, we will paste or copy the email in the chat. Yeah, it's in there. Thank you for everyone to have. And then just last meeting, we discussed the pre-solicitation training that our office provides. This training is for new contracted providers when they're starting to contract with DHHS. We wanted to make that available as a recording and on the website. And we had a goal to have it done by July 1. Unfortunately, we have not been able to meet that goal, trying to get the programming in place that we need in order to make that happen. So just to let you all know, that's not quite available yet, but as soon as we have that, it will also be another resource that's on our website. We thought it would be helpful for providers to just refer back to as they need to have that there. So that will also be available as soon as that resource is done, and we'll let you all know when that happens. And that's all, Amanda, for us.
Thank you, Carrie. I will go ahead, and I don't see that we have DCFS on yet, so I'm going to go ahead and skip that. And same with JJYS. It looks like Rachel does not have any updates on for today, but she will be available if needed for JJYS questions. So I will go ahead and I will turn that over to Chanel.
Hi, I'm Chanel Long. I'm with the Office of Substance Use and Mental Health, and we have just a couple of updates. So Amanda Alkema, which was one of our assistant directors, has accepted the position of Clinical Support Service Director with the Correctional Health Services. She's been filling in for that position for a little while as they moved those services over, and she's accepted the director position. So she'll be leaving our office and taking on that new exciting role, and we're excited for that opportunity and hope to get to work with her more. So just wanted to make that announcement. And then the Utah Fall Conference will be held this year, September 13th through the 15th in St. George, Utah. There's a pre-conference being held the 12th that will require additional registration if people are interested in that as well. And registration is currently open for that if anybody's interested in attending that conference being held this year. And that's all that we have for now. Thanks, Amanda.
Oops, helps if I unmute myself, right? Thank you so much, Chanel. We'll go ahead and we'll turn it over to Jamie with the SPD for updates.
Looks like I didn't switch out my background from the last time I used Zoom. Sorry about that. Okay, let's see. So I'm going to go over our waitlist funding. We had the legislator included funding this session to bring more people off of the DSPD waiting list and provide some respite services. So we have $3 million for one-time funds to serve people with the most critical needs on the waiting list. And we expect that to serve about 370 people. We have ARPA funding that's going to provide services to 664 individuals on the waiting list up until June of 2024. And then we have 3.6 million in ongoing funds to bring people off of the waiting list. So we think that will cover about 232 people. And then just a reminder, if you are changing a support coordinator, just remember that the choice lies with the individual and the guardian. That's always, choice of services always is tied to that individual. We've had apparently some providers who have attempted to make that change through constituent services, and I just want to clarify that that's not an option for providers to do. If there are concerns about services that are being provided, of course, feel free to contact Office of Service Review or constituent services, but again, choice of support coordinator is the individual's choice. And that is all I have.
Perfect. Thank you, Jamie. So I am going to go ahead and turn it over to, well, first, I just wanted to acknowledge that also we have Joseph from the Medicaid Long-Term Services and Supports. He does not have any updates today, but he is also available for questions, same as Rachel with JJYS and Sherry from DCFS. Just so if you have questions for them, drop them in the chat, and then I will go ahead and I will turn it over to Daphne.
Great. Thank you, Amanda. Okay, our biggest update is that we're working on a better and more consistent process for doing background screening. So we have an email that you can just email when you need to start your background screening and background screening process, which is DHHS Contracted at utah.gov. We're going to post that in the chat. We will be having further instructions on how to complete these, and the information that we need available on websites provided to DSPD, etc., so that you can have like a clear point of contact on getting this stuff done. And that is, we're hoping to have that all up to date and updated on our website no later than August 21st. But fingers crossed we can get it out a little bit sooner than that. As well, when you do email this, please just provide your name and your contract number so that we are responding correctly and getting you all set up with your background screening. And that is everything I have.
Thank you, Daphne. Appreciate those updates. I'll go ahead and turn it over to Nathan.
Hi, everybody. My name is Nathan Cruz. I'm covering for Kim Kettle today for the Office of Coordinated Care and Regional Support. The first announcement I have is we will be having our DCFS Northern Region Provider Fair September 14th. If you'd like to attend, please reach out to Mariah. We'll drop her information in the chat here. This is a great opportunity for you to meet caseworkers, system of care workers. JJS has attends in the past. Some of that, I'm going to sound old school here, but face-to-face contact to build relationships. And when you put a face to a name, it can really facilitate that connection of services. And you can get further information about what providers do, what caseworkers do, and who the people in the regions are. We've had great success and turnout for the provider fairs we've held so far in the Southwest, in the Salt Lake region, and in the Western region. So we'd love to see you there face-to-face in person, and you get an opportunity to meet and greet and build those relationships like we used to pre-pandemic. And the second thing we have is the system of care / high fidelity. We are changing our name to the intensive care coordination. That better represents our philosophy about the process overall. The referral process is evolving, and any changes we make are to ensure that we are capturing the right information in order to make the referral process as effective and efficient as possible. So as you see, we are acronym heavy here in DHHS, as I say that, but it will change from high fidelity wrap, HFW, or system of care to intensive care coordination, ICC. We're going to try and avoid jargon, but again, we think that name better represents the philosophy of what our program does. So you can see that change over. In the meantime, and feel free to reach out if you've got some of those complex cases. And that's all I have. Thank you.
Thank you so much, Nathan. All right, I will go ahead and turn it over to Joe.
Hey, thanks, Amanda. My name's Joe Doherty. I'm the Director of Communications here at DHHS, and we wanted to let you know that during this recent legislative session, the legislature approved about $500,000 for the executive branch to do a media campaign related to the harms of social media. And really the goal is to help parents get information about how to protect their kids who are online, who are navigating social media, or spending time on devices and are starting to feel isolated. You may have heard the governor as recently as this week, even on national media, talk about how that it doesn't only look like a correlation, but it looks more like causation, that social media is creating some of these harms. And so the point of this campaign is going to be let's say that social media may be harming your child, and then direct people to a website that will be created and will be live here fairly soon. And we're planning to do a pretty big kickoff with this campaign, where there will be outdoor advertising. There'll be advertising, yes, on social media and all over the place, just to help really spread the message and help parents take an active role in social media management for their children's lives. I wanted to show you briefly, this is our original campaign concept, and we've actually shot more updated videos and more like fleshed out concept now, but I wanted to just share with you really quickly what this initial concept looks like. And we call it the mask campaign. And part of the campaign is that kids are very likely masking the pain that they are suffering when they are on social media, that they look like everything is okay. But when you, and I'm sorry, I'm going to get to Adobe there. Now I can actually scroll, I think. There we go. That everything looks okay on the exterior. And yes, this looks like a very creepy mask. But when you see the harm that social media is doing, sometimes there's online bullying, sometimes there are other things that go on, even where the body image messaging that goes on can be detrimental to kids as well. And what we need to do is, even though they put on a brave face, there could be pain there, and the parents need to be involved. Now, again, this is just concepting. It's not necessarily going to be a parent hugging their kid. It may be their parent taking away the phone and saying it's time to be done with this. But we wanted to let you guys know, to be aware that when this is out there, feel free to amplify these messages on your own social media and with those that you work with who have a role in helping to protect kids from the harms that are out there. So you will see, again, you'll see billboards, online advertising. You'll see we're working on partnerships with the TV stations as well on this. And so we look forward to watching it go far and wide and protecting our youth even further. So thank you.
Thank you, Joe. I appreciate you sharing that update. Excited to see that coming out. So appreciate that. I will go ahead and we will turn to the Q&A portion of this meeting. As always, feel free to ask your questions in the chat at the bottom of the Zoom link, and we will do our best to answer all of those. The questions do not need to be related to the information shared today. If you have a question for any of our OU representatives on the call, feel free to drop those in the chat as well. I will go ahead and I'm going to ask Jamie Worthrich to answer this first question. And that is, so who does the client contact if they do want to change their, it says SC, I'm assuming that's support coordinator.
Yeah, and hopefully we can, I don't know how we're working with getting things in the chat, but you can email dspd@utah.gov, or you can contact Bob Peace or Brenda Carlisle, who are both our constituent services representatives. If you need the phone numbers, we can add them, but the email should be sufficient.
And Jamie, will you repeat that email one more time?
Yeah, and it's also in the question and answer document, if it'd be easier to copy and paste, but it's dspd@utah.gov.
Perfect. Thank you, Jamie. I appreciate you putting that there. Another question that might be for you, Jamie, says, maybe I missed it, but was there an update on the UTA contract?
There was, yes, that was on the agenda. Unfortunately, like an hour before our meeting, I'd reached out to see if we had any updated information, and the only information that I have available at this time, and I apologize for that, is that we're still negotiating the contract. So that's what we've got. Sorry.
No problem. And I assume when we have more information, we will share that out with the providers.
Yeah, absolutely.
Perfect. Thank you. All right. It doesn't look like we have any other questions. We definitely want to be responsive. So feel free to go ahead and add any questions and answers, or any questions in the Q&A, and we will try to provide our answers. While I'm giving a minute for that, I just wanted to let you all know, when we sent the email out reminding this call, we did include a survey just to hear back from you all on this meeting, and if it's serving your needs. Whenever we take time out of people's busy schedules, we want to make sure that it's meaningful and they're getting the type of information they have available. So if you haven't, please take an opportunity to fill out that survey, and we can relink it again when we send out the recording of this call. So if you haven't had a chance, you can do that. All right. While we're waiting for questions and answers, is there anything any of the OUs would like to provide that maybe they forgot about as an update that they'd like to throw in here?
Hey, Amanda, I just dropped in the survey link. So for anyone who's a participant here, obviously it'll go out in the regular emails each month as well, or each quarter as well.
Perfect. Thank you so much, Joe. I appreciate that. Well, I don't want to keep people on if we don't have any questions. So I will give it just a minute more to see if there's any other questions that anyone has. Otherwise, we will just go ahead and earn early today. As I say, going once, going twice. Well, again, as you have questions, feel free to reach out to any of us in between those quarterly calls. We did provide the DHHS CQI email. You can always email that, and we'll make sure that it gets to the correct OU to get you the answer that you need. We really do appreciate all of you taking your time to join us today. And
Hey,
it
Amanda.
looks like a question came in every time we're wrapping up. The agenda mentions staff changes. I am going to assume that was probably Chanel. Do you want to give that update again, just with the changes in substance use and mental health?
Sure. So since Amanda Alkema has taken on the new position, we're addressing how to appropriately fill her position. I think they'll be talking with executive leadership to find out the best means for the replacement and how to go about that. So we don't have any further guidance right now. I do think we would like to replace her position. We just don't know what that will look like or how that will be structured. So if you do have any further questions, or if you had something that was going to Amanda, Pamela Bennett in our office is overseeing some of the services and projects and programs that Amanda was overseeing. And then Eric Tadahara is our other assistant director. He can answer any questions that you may have. And Brent Kelsey is our director for integrated healthcare, and he can answer questions if you need something of that level as well. So we still have people within the office that can address any concerns or needs that you may have. And then hopefully we can replace her. I hope that answered the question. If not, let me know and I'll
Yeah, no
answer
problem.
whatever I can. Okay.
No, thank you, Chanel. And just for everyone to know, Amanda Alkema is still with the Department of Health and Human Services. So if you reach out to her accidentally, I'm sure she will get you in touch with the right individual. For those of you that are not aware, July 1, we officially joined forces with the clinical health services at the Department of Corrections. And so Amanda has accepted a position in that office. So again, she's still in our department. So if you forget and you still reach out to her, she'll get you to the right place. But just wanted to make sure people knew that.
Hey, Amanda, I saw that there's another question in there from Chris Smalley asking about where is the video of this meeting kept. So we do a couple things. Is once this meeting is over, we upload it to YouTube as an unlisted video, but we do send the link back out through email as a recap of this meeting with any links that we did share. And so that's where it will be. I don't think we make all these public videos. I think they're unlisted. So that way, only if you have the link to it, then you can see that video. So if you need a link from a previous meeting, feel free to let us know, either through the CQI email or messaging one of us directly. So the other, yeah, you're welcome. And then the other, I noticed that Christian Frankowski from Chrysalis had his hand raised. I would say if you have a question, feel free to drop it in the Q&A, and that way we'll make sure that we capture it that way. So.
Thank you, Joe. And then there's one more question, it looks like, that just popped in. So this would be for Jamie. It says the agenda mentioned the State Behavioral Review Committee for DSPD. So I don't know, Jamie, if there's an update you want to give on that.
Yeah, I'll start by apologizing for having things on the agenda that I didn't discuss. The State Behavior Review Committee is still up and running. It's been around for years. If you have behavior plans that include intrusive interventions that are something like a mechanical restraint, I think in the past we called them level 3 interventions, you can submit them or should submit them to the State Behavior Review Committee. I know that we've been a little bit bogged down with a lot of the plans through the USDC. So you may have reached out and not heard back, but you can contact Barbara Boswell if you have a plan that you need to submit to be reviewed. We anticipate that she'll also be reaching out to providers and contacting them if you've been a part of the review before.
Great. Thank you so much for answering that, Jamie. Any other questions that we have in here before I wrap up? It seems like if I start wrapping up, the questions will come in. So give it just another minute. Again, feel free to submit the questions outside of this meeting. We definitely want to be responsive to any questions you have. So I think I can speak for all of us on this call. Feel free to reach out if you have something we can help you with. And thank you again for those of you that are participating and submitting questions. And then, as I said that, I will go ahead and answer, or we've got one more question that came in, and I'm not sure if this is for DCFS, DSPD, or JJYS. So I might be asking any or all of you to respond. Oh, it looks like DSPD. Where can they find the rate changes for fiscal year 24?
So that's also on the agenda and also was one without context. So I apologize for that. I feel like every time I speak, I'll just start with an apology. The rates are still under review, so we actually don't have anything published yet.
Perfect. Thank you, Jamie. And again, I assume once we do have that published, we'll notify providers. Perfect. Thank you. All right. Well, thank you all very much for participating today. Absolutely, please submit those questions. I hope that this time is valuable for you all and that you were able to get some of your questions answered and get the updates that you need. We appreciate all that you do for Utahns. Without our provider network, we could not meet our vision to ensure that all Utahns live healthy and safe lives. And I probably just completely messed that up, but thank you all for your help and support in meeting our mission, and have a wonderful hot July day.